You know what? Coloradans are sick and tired of getting ripped off on the high cost of prescription drugs. It's simply unacceptable that the same exact prescription for blood pressure, for arthritis, for diabetes, costs 8-10 times as much in this country. The exact same pill made in the exact same plant costs a fraction of the cost elsewhere in the world. And that's simply unfair. There's no silver bullet to fix it all, but this bill is a big step forward in helping reduce the cost of prescription drugs and save Coloradans money. I want to thank specifically Senator Hawkins Lewis, Senator Julie Gonzalez, Representatives Chris Kennedy, and Representative Yadira Caraveo for their work on this bill. You know, even before the pandemic, 1 in 3 Coloradans couldn't afford their prescription drugs. And when people can't afford their prescription drugs, they cut corners, they clip pills, they go off of them for a period of time. It actually increases the healthcare costs that we all pay because they're more likely to wind up in the emergency room or in the need of costly medical procedures. We took a big first step in 2019. We passed legislation that allows Colorado to seek a waiver from the federal government to import prescription drugs from Canada. This year, we've extended that to other countries. But today, we take another big step forward. This bill will help ensure that prescription drugs, especially those that are the highest cost, or, you know, there are some that are generics and low cost, and they're less concerned. But those prescription drugs that are high cost, which are many of the newer ones that are revolutionary and life-saving for people, except for the fact that they can set your checking book back thousands of dollars a month. This bill will help make sure that those highest cost drugs are truly affordable for Coloradans. Over the next several years, this policy will make sure that critical medications that Coloradans need just to survive, to live, are attainable by establishing affordability cost limits for prescription drugs. It's my honor to sign this law to establish Colorado's Prescription Drug Affordability Board. I also want to acknowledge from the Office of Saving People Money on Healthcare, we have Caitlin Westerson, Isabel Nathanson, and Serena Woods. Thank you for your work. Elizabeth Arenales from my office. We're joined by the Speaker of the General Assembly, Alec Garnett. You can't miss him. Kim Bimsteffer from HICBUF, Mike Conway, the Commissioner of Insurance. And you know, most importantly, we have patients here and members of the large coalition that made this possible, looking out for the health of Coloradans, making sure that Coloradans have access to life-saving drugs. I want to thank CCHI, the MS Society, AARP, CCAT, physicians that have joined us, Dylan Roberts, Carrie Donovan, many, many others. Colorado is fortunate to have a champion of saving people money on health care as our Lieutenant Governor. It's my honor to introduce the Lieutenant Governor of the great state of Colorado, Diane Primavera.
Well, good morning, everyone, and thank you, Governor. I also would like to thank the bill sponsors. I know how hard you've worked. And the Coalition of Advocates, we couldn't do it without your voice, and especially the Colorado Consumer Health Initiative, who worked so hard to pass this bill. I'm really proud to stand here with the Governor as he signs this pivotal legislation that will create the Prescription Drug Affordability Board, which will play an important role in helping Coloradans save money on life-saving prescription drugs. You know, this is a health equity issue. A lack of affordable drugs to treat pre-existing conditions like certain cancers and cardiovascular disease disproportionately affects low-income Coloradoans and communities of color. This bill will help ensure a Colorado for all, where everyone can access the medications they need to be healthy and thrive. As someone who's been diagnosed with 4 different kinds of cancers and survived, I personally know how hard it can be to manage the cost of health care, the daily necessities of raising a family, but I've also heard it from Coloradoans. When I worked at Healthcare Policy and Financing as the manager of customer service, I heard heartbreaking stories directly from Coloradoans that they were cutting their pills in half or having to choose between groceries and medications. Later, when I worked at Susan G. Komen Foundation Colorado, I heard the same heartbreaking stories from cancer patients. And now as Lieutenant Governor and the Director of the Office of Saving People Money on Healthcare, I continue to hear the same stories. As recently as October 2020, I hosted a roundtable with consumers who told me directly that they still struggle with affording their prescription drugs. That's why I'm proud to see the Governor sign this bill into law today. I hope that in doing so, we can help Coloradoans access the medications that they need without breaking the bank. So now I'd like to turn it over to one of our wonderful bill sponsors, Senator Hawkins Lewis.
Thank you, everyone. Good morning. I'm Senator Sonia Hawkins Lewis, representing Senate District 17. This has been a true labor of love. Many of you know that I am a pharmacist by training, and there was not a day that went by in my career as a pharmacist where we didn't have patients coming into the pharmacy who could not pay for their prescription drugs. It was really, as the Lieutenant Governor said, it was a struggle between basic living cost and paying for life-saving drugs. So even though many of us here had been working on this issue for many years, we really have put together what I think is the most crucial and historic legislation that we've seen in addressing lowering the price of prescription drugs with this Prescription Drug Affordability Board. Why do I believe that? Because it works in every other country in the world. There's only 2 countries in the world that don't have some kind of mechanism to have a board with clinically trained drug reviewers that look at affordability. And now Colorado will be the first state in the country to have both, as I call it, the carrot and the stick. With the upper payment limit, we can make drugs affordable for Coloradans. I don't want to spend a lot of time on the bill because you can read it and you can see what it's going to do. But I just want to say that when you have so many people that are struggling coming out of COVID, we already knew this was the #1 issue going in. We really think that this could finally give us the combination in treating, helping patients afford their drugs with transparency and being able to say, this is what is affordable for Coloradans. So there's so many people to thank: the governor, the lieutenant governor, the Office of Saving People Money on Healthcare. You know who you are: Diana, Elizabeth, David, Isabel, Adam, so many. I can't thank you all, but thank you so much for making this happen. This is going to be transformative. So thank you very much.
Hi, y'all. My name is Senator Julie Gonzalez. I'm honored to represent North, West, and downtown Denver in the state Senate. And I'm also honored to be a co-prime sponsor of Senate Bill 175, the Prescription Drug Affordability Board bill. Y'all, I'm not a healthcare expert, but I fight hard for economic justice. I fight hard for racial justice. And when I heard from my constituents who were telling me, Julie, I don't know whether I'm going to make rent or I'm going to be able to afford my prescription drugs, that's when I knew that we have to do everything that we can in order to save people money on healthcare and make the cost of healthcare more affordable for everyday Coloradans. When I heard from constituents who were telling me their stories about their fear about going to the doctor, because why would I go to the doctor in the first place if they're going to just prescribe me something that I can't afford, I realized that we had to do something. And I'm honored that I was invited to join this effort. Even though I'm not an expert on healthcare policy, I learned a lot. And what I learned is that oftentimes the opposition hides itself, clouds itself behind all of this process and all of these processes that everyday Coloradans don't understand. I'm proud that the folks here the patients, the advocacy organizations, the healthcare experts, the legislators. We did the work in order to make history in the state of Colorado. And with the passage of this bill, with Governor Polis signing it into law, I'm excited to go back to community and say, y'all, we did it. Thank you so much. And now I just want to shout out to my amazing co-sponsors on this bill. And now I'm going to turn it over to Representative Caraveo.
Good morning, everyone. My name is Yadira Carabeo, and I'm the state representative for House District 31 in Thornton. And now that the session is over, I've gone back to being a pediatrician, which is what I do the other 8 months of the year. And when I went to medical school, I knew that I'd be talking to patients about their conditions, their medical diagnosis, what their outcomes might be, what prescriptions I thought that what they would need to treat their conditions. I never thought that I'd be spending more and more time every year talking about whether they could afford those prescriptions. 1 in 3 Coloradans has to either not take a medication or cut back on what a doctor has recommended because they can't afford what their doctor has recommended. And I have those conversations in clinic every single week, whether it's something as simple as an eye antibiotic to treat pink eye or something life-saving like an asthma medication. Time and time again, I have to tell patients, this is what I think you should be treated with. Call me if you cannot afford it, because I've seen far too many patients who come back weeks or months later, their condition is worsened, and I say, what happened? And they say, well, I couldn't afford my prescription, so I decided not to take it. That's not what I went to medical school for, but that problem was what led me to become a state legislator. And with these other incredible co-sponsors that I have, I think that we have made an incredible stride this year as the governor signs this bill in protecting the patients that I see in clinic every day so that doctors don't have to have those conversations. We can go back to having medical decisions and talks about what is going to make you better, not can you afford it. So thank you so much to all the groups that have worked for years, honestly, on this legislation. And with that, I will turn it over to somebody who has become an expert in healthcare policy, Chris Kennedy.
Good morning. My name is Chris Kennedy. I represent House District 23 in Lakewood and Central Jeffco, and I'm really excited that I had an opportunity to be one of the House sponsors on this bill. Of course, as many of you who've been around here know, a lot of the work gets done in the first chamber, so we couldn't have done this without our Senate sponsors who really did the heavy lifting in the governor's office, who had our backs every step of the way. If there's one issue I've heard about consistently from my constituents knocking on doors since the first time I started campaigning in 2015, it has been the high cost of health care. And while we've made progress on a lot of places, trying to address the high cost of prescription drugs has been an issue that has been really challenging to solve. And I'm really pleased that this is the year we finally got this bill across the finish line after years of trying to get pharmaceutical transparency bills done and other efforts. This time, not only did we get the transparency on the drug prices, but actually a mechanism to hold pharma's feet to the fire and make sure they're bringing down the cost of drugs. Now, make no mistake about it, these drugs save lives. A lot of these things that the pharmaceutical companies are coming up with are permanently changing people's lives for the better or saving their lives. And we care about their access to these drugs. But just because these drugs save lives doesn't mean that they should bankrupt a family. And there's increasing evidence that it is not the research and development or the development costs that drive the prices, but it is instead what the market will bear. Well, this is not a competitive marketplace. This is not a place where competition between drug companies, in large part because of intellectual property laws, they don't drive down prices on their own. And this is a place where we have an opportunity to say, this is how we're going to look at the drug prices. And if you can't justify the cost, we're going to put this upper payment limit in place. Now, if a drug company believes that they could justify the cost based on the R&D, based on the other development costs that went into it, they're going to have every opportunity to provide that information to the board and make the case that there should not be an upper payment limit on their drug. But we really believe that we've put together a process, a way to put together experts who are going to know what they're talking about when they look at these prices. And this is going to be a huge policy for Colorado, making sure we continue to have access to these life-saving drugs, but at costs that Colorado families can afford. So thank you all so much for being here. And I don't know who I'm supposed to introduce next, so maybe I'll just step back.
Let's see. I think we're ready to sign it.
Are we ready to sign it? All right.
So let's make some history and save people money on prescription drugs. Are we ready?
You first. I'm taller. I can look over your shoulder. Good job. Thank you.
It's officially the law of Colorado. Congratulations.
Thank you, Governor.
And one for the speaker. Thank you, everybody.
Thank you.
Great work. Really great work on getting this through. Yeah, a lot of fights ahead.
Oh, yes. Thanks, Governor. Thank you. Appreciate you.
There's another bill that we're going to sign to save people money on health care today. And I want to acknowledge, both the prescription drug bill, the Colorado option, these are more than just nibbling around the margins of saving people money on health care. There's always a bunch of feel-good bills that people, come together on. And the fact that everybody comes together on usually means they just help a little bit. But when you're really getting close to solving an issue, like the high cost of health care, the temperature in this building starts to rise. There's a lot more lobbyists out to stop it. There's a lot more outside communications demonizing our hardworking public servants that are trying to save people money. And when that starts happening, you know that they're getting close to a real solution that will work for everyday Coloradans. And by that measure, I'm confident that this Colorado option will get the job done, saving people 15% on health care costs. I want to thank Representative Dylan Roberts, Representative Joda, Senator Donovan for their hard work on this bill. We'll give it a moment here. The amazing staff, Caitlin Westerson, Isabel Nathanson, Serena Woods, Elizabeth Arnales. I also want to thank David Oppenheim and Mike Conway for working with legislators to keep this bill and resuscitate it and get it to work, and are helping the legislators count the votes and really make sure that nothing that happened to the bill would prevent it from saving people money on health care. That was always the North Star. There's different forms that could take. I think the bottom line, we'll give it a moment here again. Somebody needs health care. The bottom line for the sponsors was always, will it save people money on health care? And there's different ways to do that, setting up different programs. This bill has the tools to do it. It will get it done. We're also joined, in addition to Mike Conway, by Kim Bimsteffer, staff at DOI and HICPUF, and many representatives of the broader coalition that made this possible. CCHI, Healthier Colorado, Calor, Hilltop, and many others. This was really a lot of work that went into this historic day in Colorado. I'm about to sign the bill to create the Colorado Health Insurance Option. Thanks to the work of Senator Donovan, Representative Roberts, Representative Judah, we are going to give Coloradans more choice on health care. I want to thank the leadership of our Lieutenant Governor, the head of the Office of Saving People Money on Health Care, Diane Primavera. This legislation will make sure that the Colorado option reduces your insurance premiums by at least 15% within the next 3 years compared to other plans on the market. It'll be available to individuals and small group market. That means many people who buy insurance through their small business will also benefit from this bill. It'll be a higher value plan. It'll have a more diverse network of providers. Saving people money on health care is really core to our goals and our needs as a state. It's more than just health care. It's the well-being of our communities. It's economic security for ourselves, our families, and our small businesses. So today I'm proud to celebrate the work of Representative Roberts, Representative Judah, and Senator Donovan to deliver on our promise to save people money on health care and take us, in Colorado, from some of the highest health insurance costs in the country to some of the lower health insurance costs in the United States. With that, I'll turn it over to our Lieutenant Governor and head of the Office of Saving People Money on Health Care, Diane Primavera.
Well, thank you, Governor, and sadly, that's probably someone who does need health care, unfortunately. As a public servant, an advocate, a grandmother, a mother, and a patient, I've spent my life and career working to increase access to quality, affordable health care for all. So now, as the director of the Office of Saving People Money on Health Care, I'm proud to see the governor sign this priority legislation for the office that will make it possible for so many Coloradoans who have been left behind by our healthcare system to access affordable care that they need and, most importantly, that they deserve. I'd really like to thank the bill sponsors. I know the long hours and late nights that you put in, along with the coalition of supporters and advocates for tirelessly working to create a healthier and more equitable reality for Coloradoans. It's about time that there's an affordable option for the hardworking residents and small business owners of our state. As a cancer survivor, I know what it feels like to sit in front of a doctor and search for answers. The new requirements in this bill will break down barriers and represent a breakthrough approach to ensuring that Coloradoans are served by providers that they feel comfortable with and supported by. The Colorado option also provides more options for high-quality, affordable health insurance. In Colorado, the uninsured rate for Black residents is higher than for white Coloradoans, and Latinx people are more than twice as likely to be uninsured than white people in Colorado. We know that almost 90% of Coloradoans who don't have insurance say it's the cost that is prohibitive. The Colorado option provides a more affordable option for our residents and will make it easier for our communities to stay healthy and be financially secure. This is an exciting day for saving people money on health care, so thank you, Governor, for signing the bill into law. And now I'm going to hand it over to our hardworking Representative, Dylan Roberts.
All right, good morning, everybody. Thank you all for being here. This is an exciting day, and it's a long time coming, very long time coming. So first, I just need to thank some folks, to my co-sponsors, Representative Judah, my partner in the House, and Speaker Garnett for your leadership on this in our chamber, and Senator Donovan. We've been working on this a long time, and she's been working on it much longer than I have. Couldn't have done it without this team, and I'm so honored to be a part of that coalition that got this done. To the governor's office, Commissioner Conway, David Oppenheim, and the whole team who helped us navigate the incredibly complex world of health insurance and health care. Our healthcare partners, we worked with many doctors, hospitals, nurses, insurance companies, the people who truly came to the table to make this bill a workable bill. Thank you. And to our advocacy team. We knew we were going up against the most well-funded opposition, and I think this is going to go down as the most lobbied against bill in Colorado history. But we always knew that patient stories and the reason we were doing this work was going to win the day, and it did. We're here today, and we beat it back. So thank you so much to the advocacy team. We could not have done this without you. Yesterday in preparation for this, I was going through my email. I have a folder of constituents who contact me about healthcare. It's a huge folder at this point. I'm sure Senator Donovan's is even bigger. But I wanted to look at why we did this work, because this is the number one issue that I hear about from my constituents in Eagle County and Routt County and on the Western Slope, and some truly heartbreaking stories that have driven us to do this hard work. There's an email in there about a couple saying that they were going to have to move away from Colorado because they could not afford insurance in Eagle County. There was a young woman who contacted me saying that she's going to have to leave her dream job at a nonprofit because that nonprofit can't offer health insurance. And then the type 1 diabetic in the Roaring Fork Valley who says her deductible is completely unreasonable. She can never afford her out-of-pocket costs for her critical condition, and she couldn't buy a new health insurance plan because she only had one choice. Today, that changes because the Colorado option means that every Coloradan, regardless of whatever county they live in, is going to have access to an affordable and quality health insurance plan. And I could not be more excited. This is going to help change the lives of thousands of Coloradans. Doing big things is hard, but doing big things is worth it because this bill is going to change the lives of thousands of Coloradans, of small businesses, and of people who need access to our wonderful healthcare system at an affordable price. So thank you, Governor Polis, for signing this into law. This is a really big day for our state. I'm so excited to be here. Thank you.
Good morning, friends. My name is Iman Judah, and I am the House Representative for House District 41. I too want to thank, I too want to thank the coalition in particular for standing up for their values and what they believe the people of Colorado truly believe. Many of us share a lived experience in the lack of health care or affordable health care. I'm one of these people living with epilepsy. I have always been dumbfounded with how much the cost of my procedures or my care has been. I've watched Dad live with cancer, and the need to lean on assistance, again, always left me in shock. I think with being a co-sponsor or a House co-prime on this bill, I've realized and always have believed that the shared experience that we live around affordable health care is something that we refuse to let continue here in Colorado. The reality is, wanting affordable, quality health care should never be a controversial issue driven by profit motive or profit driven. This bill will protect Coloradans regardless of their zip code, the color of their skin, or their residency status. Again, I want to thank my co-primes, Representative Roberts and Senator Carrie Donovan, for bringing me in and allowing me to share my lived experiences and again, be an advocate for people of color and make sure that we are inclusive and that we are fighting for all Coloradans. Thank you.
Good morning, everyone. What a remarkable moment. And I think over the past months and years, actually, we've tried as a group of folks to take moments to pause in the speed and anxiousness of what it means to try to write laws and have them passed, to appreciate what we've actually accomplished. And bill signings provide that very specific moment in time to think about what we've done to arrive at this, what is actually, at the end of the day, a very simple act, but a very meaningful and momentous moment. My name is Carrie Donovan. I'm the state senator for Senate District 5, which is 7 counties that stretches across the Continental Divide and out into western Colorado. And when I began running for my first term as a state senator in 2013, the story that I heard door after door was that we had the most expensive healthcare in the country on the individual market. Our ski towns love being named #1. We did not like being named #1 in this particular category. It was not great to be at the top when it came to the cost of healthcare. And so we started having tough, hard, meaningful conversations about what we could do as a state to respond to a national problem. And as Colorado always does, we don't shirk away from the big issues. Instead, we say failure is not an option. And that's what we did with this bill, even though it has taken years for us to get here, including the hard work of the previous administration under Hickenlooper and his lieutenant governor, who started these conversations. I remember having that meeting in that great, huge table in the lieutenant governor's office about what we could do, and here we stand later. I also, while thanking all of you who are joining us on the steps, thank you. You fill my heart. I do also want to thank often the unsung heroes of every bill signing. And those are the incredible aides that help every representative and senator make sure that their bills get across the finish line. In 7 years, I've had 6 remarkable people who have served as my aide for Senate District 5. And I have 2 of them here today, Marley and Allie, who, without their help, their names are never in their paper, their names never make it into the talking points. But we all know that without aides, we would not pass laws. So thank you to all the aides. In 2013, I knocked on a door in Buena Vista, and it was this lovely young woman who was pursuing her passion of creating pottery. And at that point, I was an unknown candidate with nothing but a promise that I would go to the Capitol and work for her. She gave me a cup that you often see me carrying around the building, and I have it on the floor, filled with whatever delightful coffee we have made for us that morning. And by delightful, I mean absolutely horrible, right? Because the coffee is the worse the coffee is, the actual better it is for making law. That cup serves to remind me of why I'm here, and it's to bring the voice of the constituents of the Western Slope and the Upper Arkansas Valley here. Her voice that day was, I cannot afford to pursue my dream in your district of making pots my passion, sharing my art and my talent, because I cannot afford to do that and purchase health care. Those 2 things do not align. That was the one of many stories that I heard over the years, including couples having to choose who was going to buy health care that year because both of them couldn't afford it. It was small business owners not being able to expand their businesses because they could not have an opportunity to offer the benefit of health care as part of their small business package. And all these stories added up to why we came here today after a multi-million-dollar effort of lobbying against this bill. We came with consumer stories, the passion of consumer advocates, and medical professionals that stepped up big time to share the stories from their perspective. And combining all of those pieces, we were able to count enough votes to get this bill passed. And what that means at the end of the day, as we stand under a flag that reminds us of how important equity is that we will be able to have a new option for every citizen of Colorado on the individual and small group market that will be cheaper, will be added consumer choice, and for one of the first times in the country, we brought equity into the conversation of healthcare coverage, and that is leadership that we should all be proud of. So thank you to everyone. Today is a momentous day, not only in the history of Colorado, but in the advancement of progressive healthcare, and we couldn't have done it if we hadn't joined together in one voice saying that we have to put people before profits, and that's who we fight for. Thank you.
Let's make history. Are we ready?
Let's do it.
It's officially the law of Colorado. Congratulations. Mr. Speaker, you get a pen?
Yes, he does. Thank you, Governor. Yeah.
And I think we have to speak about them.
Yes, you definitely deserve it.
Congratulations. Oh, we didn't bring you in.
We were able to avoid the amendment that would have made him run. I had the Conway for Commissioner signs.
I want to vote for you.
Great job.